Today we're going to be talking about sleep-wake disorders, specifically dyssomnias. Okay, so to begin, we're talking about insomnia first. What is insomnia? We're on 33. Insomnia is a persistent disorder that can make it hard to fall asleep, hard to stay asleep, or both, despite the opportunity to have adequate sleep. Insomnia usually feel awake, feeling unrefreshed, which takes tolls on daily activities, and which classifies this as a disorder as it impairs functioning. Difficulty falling asleep at night, awake during the night, waking too early, irritability, depression or anxiety, difficulty paying attention. A lot of things that come with just not having enough energy. Treatment includes education about good sleeping habits. Good sleeping habits include a regular sleeping schedule, avoiding stimulating activities before going to bed. Cognitive behavioral therapy is also going to be helpful. Really, this helps you control or eliminate those negative thoughts or worries that keep you awake, that encourage this behavior to keep going on. May also involve eliminating false or worrisome beliefs about sleep, such as the idea that a single restless night will make you sick. So, current research is being done on light therapy, which is, can help. A light has a lot to do with our brains and the amount of melatonin that might be released to help us fall asleep. So some people are getting medical grade light boxes to help them, and the research is showing that's been helpful. So hypersomnolence, that would be 34. I'm going to stop using so many fingers. Hypersomnia refers to either excessive daytime sleepiness or excessive time spent sleeping. It's a condition in which a person has trouble staying awake during the day. People who have hyperinsomnia can fall asleep at any time, for instance at work or while they're driving. But the problem is it may include a lack of energy and still trouble thinking clearly. Treatment, stimulants, and antidepressants are common medications that are prescribed. If they are diagnosed with sleep apnea, the doctor may prescribe a treatment known as continuative positive airway pressure, which is a CPAP. It's a machine you can see sometimes people carrying around with them if they're going on trips, that kind of thing, so they can get good sleep. Current research findings, medical conditions that are comorbid maybe include multiple sclerosis, depression, encephalitis, epilepsy, or obesity. It may contribute to this disorder, so maybe working to eliminate those is going to be helpful. Okay, narcolepsy, we got 35. Defined. So narcolepsy is a chronic sleep disorder which is characterized by overwhelming daytime drowsiness, sudden attacks of sleep. People with these just instantly fall asleep. That's narcolepsy. Regardless of the circumstances. So, treatment. Drugs that stimulate the central nervous system are the primary treatment to help people with narcolepsy. Provigil, Nuvigil, you'll want to use these. Current research. Emerging treatments are being investigated for narcolepsy that include hypocretin replacement, hypocretin gene therapy, and immunotherapy. Further research is needed before any may be available in clinical practice. Here we have 36 breathing-related sleep disorders. So sleep apnea is potentially serious sleep disorder in which breathing repeatedly stops and starts. This can be really troublesome for people who are trying to get a good night's sleep. And also really keep the brain healthy, because the brain's going to need that oxygen that comes during the sleep. Complex sleep apnea syndrome occurs when someone has both obstructive sleep apnea and central sleep apnea. The most common treatment for sleep apnea is a device called CPAP. This device makes the air pressure somewhat greater than that of the surrounding air, just to keep your upper airway passages open. Another device is called the EPAP, and it can also be used. This is a small single-use device placed over each nostril before you go to sleep. The device is a valve that allows air to move in freely in, but when you exhale, air must go through small holes in the valve. This increases pressure in the airway and keeps it open. Research is being done on oral appliances to be a reliable treatment for sleep apnea. Oral appliances decide to open your throat by bringing your jaw forward, which can sometimes relieve snoring and mild obstructive sleep apnea. 37. 3-7. So we got circadian rhythm sleep disorders. Defined as a family of sleep disorders that affect the timing of your sleep. So people with circadian rhythm disorders are able to go to sleep and awaken at the times commonly required for work and school. They're generally able to get enough sleep if allowed to sleep and wake at the times dictated by their body clocks. But their body clocks are really out of whack, so this can interfere with daily functioning because a lot of the jobs in our society really go according to specific times that may interfere with their body clocks. Medications such as melatonin and Provigil or other short-term sleep aids, such as maybe a method of treatment that's beneficial for people that are affected this way. A newer form of treatment for this disorder is called dark therapy. An example of dark therapy is using blue blocking goggles. These block the blue and blue-green wavelength light from reaching the eye during evening hours so that the production of melatonin is not decreased or eliminated. So that's all for sleep-wake disorders, specifically those with dysomnias, and we're going to move on to parasomnias next.